Learn to enjoy every minute of your life. Don't wait for something outside of yourself to make you happy in the future, whether it's at work or with your family. Be happy now. On this week's episode of, my life, we are heading to 100 Mile House. I just finished my last day of OBGYN. What better time to have a tips on clerkship video, in this case with an emphasis on women's health. I have to say, I don't know if it's just the honeymoon phase of clerkship, but I absolutely loved it. The beginning was difficult, I have to say. My first week was 80 hours, and then after that, I don't think I worked anything less than a 50-60 hour week. So the hours were long, but it's so gratifying to be actually doing something in the hospital rather than sitting in a classroom like we were for the first 2 years. And if you're someone who has trouble in pre-clerkship, whether it's trying to understand the material or apply the material, that was me for a part of pre-clerkship. But even the stuff that I struggled with, I'm able to apply it so much more in practice. When you see something in real life and you can put it to a patient's face, it really helps to solidify it. So if you're struggling in your first 2 years of med school, I wouldn't worry at all, because I really think that it's going to come easier once you're in practice, and especially in clerkship when you're still in the learning phase. One thing that I'm really grateful for is that the preceptors that we had here, whether it was family doctors or obstetricians, they were really invested in teaching. A regular delivery, and by regular I mean non-high risk, so the majority are all done by family doctors here, and they really put time in to teach you how to do things. So if I can give you one tip about clerkship, well, I guess before actually starting clerkship, I would ask people what to do. And the number one advice I would get is to be keen and to be interested. And I was like, okay, what is this? Be keen, be interested. Like, who isn't going to be interested in what they're doing? But I can already see people kind of giving up. Maybe giving up isn't the right word, but if they're not interested, it's quite obvious that they're not. And it's not just med students, but residents also. People can tell when you're not interested in the work. And I would say being keen is really important. Offer to do stuff, take on tasks, and really show that you're willing to and wanting to learn. And I don't mean staying late every day or coming early, but just doing work in your schedule, in the allotted time that you're at work for. I was talking to some friends of mine, and I really think a part of clerkship is obviously the learning, but at the end of the day, we're not making any decisions about patient care. We're just trying to learn about how management works and how decisions are made. But I think a bigger part of clerkship is learning how to work with different people. Interprofessionalism and collaboration, they're all buzzwords that we hear in pre-clerkship, but there's so many people who don't know how to work with people in the professional fields. For example, myself, when I first started working, which was probably about 4 or 5 years ago, that was my first exposure to working in a hospital. And I was working with specialists, with physicians, with family doctors, people from different fields, with patients. And now I feel like I'm pretty comfortable doing that. But there's some people where this is their first exposure, and a part of clerkship is learning how to deal with different personalities. Another tip I would say is to put in effort. Yes, you can go to work and move through the motions of getting things done, seeing patients, but it's really obvious when you're putting in an effort and when you're not. And this kind of goes hand in hand with being keen and making it obvious that you want to learn. So the next thing I would say is to take time for yourself. Again, these are all things that we're always told, but it's so difficult to do. And sometimes people blame the programs and the system and say that the system isn't made for us to take care of ourselves. But honestly, if we're always putting the blame on other people, we're never going to get what we want. So take the ownership yourself to take care of yourself. For example, right now I'm an Obgyn, and I would say it's one of the harder rotations in terms of the hours that we're putting in. Obviously, surgery would probably be harder, but with that, I've had my parents come up for a long weekend and basically spent the weekend with them. I went out to Vancouver last weekend, and now I'm here in 100 Mile House. So that's 3 weekends in a 6-week span that I've been able to get away from Prince George and just take some time to relax and not be completely stressed out about clerkship. This is just the beginning, and if you're so stressed out right now, it's just going to make it more difficult, not only for 3rd and 4th year, but also throughout residency and practice. Life isn't going to get any easier than it is right now. It's only going to get more difficult. So I really believe that it's important to solidify those skills. Obviously skills in medicine, but also the skills that are needed to take care of yourself. And I feel like when I'm at work, I'm much happier when I'm doing things like this on the weekend, or if I'm going to the gym after work, or if I'm going biking and things like that. This may just be my perspective of medicine, but I am not a doctor, and I won't be a doctor. As in, that will never be my identity. My identity will always be what makes me me, and medicine is just going to be a part of that. So it's really important for me to be able to do things that I like outside of work, because at the end of the day, medicine is a job, and I don't want it to consume my entire life. So I'm making it a priority to start those things now. I wanted to try water skiing for so long, and I finally got up, but look who's struggling over there. So this is the best relaxation method from clerkship. One of the other things that you should do for clerkship is to really focus on some key topics that you're going to see. So in Obgyn, for instance, it's difficult because it's 2 full topics, obstetrics and gynecology. So there's a lot to know. And with any rotation that you're on, if you think about it, it's a 5-year specialty to really know what's happening on that rotation. And it's impossible to know everything. So if you know some of the, oh my god, these mosquitoes. So if you know some of the key things that you're going to see, some of the most common topics and common conditions, it'll really give you a leg up in terms of your rotation. So for instance, this week in Obgyn, some of the most common things in the office, for instance, dysmenorrhea, menorrhagia, amenorrhea, pelvic prolapse, those are all very common things that you see. So it's important to read up on them and then know the treatment and the management for them as well. In surgery, for instance, though, there's different things. So basically, it's the surgeries to fix those conditions. So a sacrospinous ligament fixation, hysterectomies, D&Cs, endometrial ablations, those are all very common things that you're going to see in the OR. And then finally, in labor and delivery, I'm just trying to get these mosquitoes away from me. So in LDR, obviously the course of pregnancy is really important, but also the problems that are going to arise. So first of all, you're only going to know those problems if you know the general course of a normal pregnancy. The cardinal movements are important. Leopold's maneuvers are important. Knowing where baby is, knowing how to read EFMs, and fetal monitoring. And then once you know those things, then you're able to know what to do in the case of an emergency. So shoulder dystocia is really important. PPH is really important. Prolonged labor is really important, and knowing, okay, when is this labor so long that we should go to C-section? So those are some of the things in obstetrics that I've come across in the past 6 weeks that have been quite important to know the management for. But these are things that you should do for all of your rotations. For example, coming on to pediatrics, I haven't spoken to my friends who are on there yet, but for instance, in Prince George, we don't deliver babies before 30 weeks of gestation. We'll send them down to Vancouver. So above 30 weeks, that's what I'll be focusing on. Respiratory distress is really common, so that's something that I'm going to read up on this weekend. So in terms of clerkship, those are a lot of the tips that I would say have helped me in the past 6 weeks. The video and found at least some of it useful. At the time, that was only my first block of clerkship, so I was relatively new, but let me know if you like these videos. If it's something that will be useful for you, I can continue making them about pearls about clerkship in general, or even block specific things to study like I mentioned in this video. If you want to see more of these, let me know in the comments below. Otherwise, don't forget to subscribe and hit that bell notification so you know when I post a new video. Alright, I'll see you in the next one.